A problem that we as clinicians or as psychological evaluators encounter is confusing side effects by medications as legitimate mental health issues. Case in point, recently a patient of mine came in complaining of lapses in memory, feelings of agitation, and anxiety. Now, mind you, she had never presented with these issues in the past. Her main issue that brought her to therapy was depression, and depression associated with a recent dissolution of a relationship. Now, after discussing the anxiety and the memory and her fear that she might be coming down with an early form of dementia, we had come to discover that she had recently changed prescriptions on a medication, and the medication was a statin. Now, statins are normally prescribed to treat cholesterol or high cholesterol and to help with the prevention of the effects of cholesterol on and the prescriptions of and to serve as a preventative measure for possible stroke and heart disease. Well, after she revealed this information, it was clear that she had been responding to this new medication quite badly. And after referring her back to her primary physician, she was able to make that change from the statin back to her original medication. And lo and behold, the symptoms that were plaguing her beforehand had abated. They had gone away. So before you start thinking that something that's happening to you as in terms of cognition, in terms of awareness and concentration, in terms of even anxiety and depression, is part of who you are or what's going on inside of you without any outside effects. I consider medications as an outside effect. Look into what you're putting into your body, what changes you might have had in medications, because many medications have side effects that are related to depression and anxiety. Another evaluation that I had today, the patient mentioned that he's not able to tolerate medications, or he's not able to tolerate psychotropic medications, which leaves him very little to use to help address his PTSD symptoms. Well, while this was only an evaluation, of course, it's a referral back to his primary. And his No. A second topic I'd like to share with you is one that's probably more on the lines of a fringe idea. And this idea stems from recent experiences that we have had in my family. And the one particular experience is the death of my mother-in-law. Now, my mother-in-law had been sick for some time, and the sickness is related to a form of Parkinson's dementia that is quite unusual, quite rare, and she had been deteriorating over months, and the illness was short term, and she had just recently died. And in that last week, mind you, in that last weekend, it was a Friday, and my wife had suddenly started complaining of these pains across her body. Sharp pains in her joints, sharp pains in her back. She had a massive headache. She felt nauseated. And we were wondering what could this be? And we tried everything. We tried water. We tried to address it with some just food. She wasn't able to eat. Massage, hot shower. but we had no idea where this pain was coming from, and she had never had an experience like this in the past. Now, the next day, we get a phone call, and the phone call is that my mother-in-law, her mother had died in the middle of the night. Now, when we woke up in the morning, my wife no longer had any of the experiences. She had no longer experienced any pain, none of the nausea. We found it to be quite unusual, quite coincidental, that my wife would have such an unusual reaction without any knowledge of the condition her mother was in, when the feelings that she had across her body were arguably related to what my mother-in-law had been experiencing in the last few months of her life. And since then, over the last 2 months since my mother-in-law's death, my wife in the last 2 months since my mother-in-law had passed, my wife has not had any such experiences again. Now, I bring this up because this isn't the first time I hear of such an experience, an unusual connection, a extrasensory understanding of what is going on with somebody else that you know, somebody that you're close to. Many of you might have had experiences where you have a thought of your mother, and suddenly she calls, or that you get this unusual feeling that your father is in danger and you call him and he had just had an accident. It happens between siblings, and in psychology, there's this myth on the connections between twins, identical twins. Well, while we cannot explain it, I think it's important to understand that these relationships do present themselves in clinical practice as well as in a family's general experience. It might suggest the connections that they have emotionally, and it might suggest something that has gone unsaid, or a form of communication that is outside of our ability to speak to each other because of distance. It's unknown, but what isn't unknown is that these experiences do present themselves. And to those clinicians who might easily discard these experiences as psychological, coincidental, that have no bearing on a person's connection to their partner, to their family, to their parent, I beg you to differ in this. I suggest to change the framework because it helps a person understand how their relationship with that person actually is, and it can help with managing grief, most importantly. This is Dr. Vittorio Puente. So please subscribe to my This is Dr. Vittorio. This is Dr. Vittorio Puente. If you like these videos and you'd like to hear more, subscribe to my YouTube channel, or go to my website, Mid-Valley Behavioral Health and Psychological Services, mbhps.com, and check out my blogs. Until next time, take care of yourself and be safe.